Everybody, welcome back to Bayou Time. We're still talking about, life after the storm. It's almost 6 weeks now, but still a lot of things are getting back to normal, and a lot of things will never be normal again. Hopefully one of those things that are now normal is we're bringing Dr. Jimmy Ponder. He's the medical director of the Headache and Pain Center. Of course, you got a couple of shops. You got one right there off of Highway 90. You got another one in New Iberia. This really had to affect you for a while with no power. I guess you guys were out of business for a little while too.
We were, Harry. We were, we didn't suffer that much damage to our building physically, but power was out for several weeks. That made us unable to do our procedures, our X-ray guided and ultrasound guided procedures. So we couldn't do that for several weeks. We did try to open our clinic up and see patients and try to schedule their procedures a little further out. But fortunately, our New Iberia office didn't get any damage. And as you drove after the hurricane, you get to Morgan City and nothing happened. So you go even further west to New Iberia. Our New Iberia office was fine. So, a few people did want to have their procedures done, and we were able to do them in our New Iberia office, which we pretty much have a mirror type practice there. We have a outpatient surgical center. We have our clinic. We have an open MRI, X-ray, bone density. So we basically had the same ability in New Iberia to do what we do in Gray here. So we were able to still kind of maintain some of our patients at that facility.
Yeah, unfortunately, a lot of us had to drive to New Iberia to get gas, at certain times, go to the Walmart there. I did that a couple of times.
I went through that too at the gas stations and the grocery.
But let's talk about it. Look, with pains and headache, obviously this is not something, our life kind of paused here for a month. Mm-hmm. Those things don't pause, right? Every morning, if you get a migraine headache, or in a cluster headache or whatever kind of headache you might have, that's going to come and that actually might be aggravated by conditions of the storm. Same with pain, back pain, those kind of things. That doesn't pause for a month. So how your patients dealing with that?
Well, fortunately, our patients were able to keep in contact with us, even though we didn't have telephones. One through our New Iberia office, they were able to contact us through there, and they were able to send messages through our website. So a lot of patients that ran out of their medications, they were taken to prevent headaches, or maybe they were taking some medication for their back or their neck. They were able to send us messages that we got through email. So we were able to refill a lot of those type medications. And like I said, if somebody really needed a procedure urgently, we could schedule it at our New Iberia office, or actually see them in our clinic in New Iberia.
Right. Mm-hmm. Yeah, so they could still get around, that's for sure. And things are back to normal though, right? So you were up now, and a lot of folks, we were kind of not giggling, but saying your business ought to be doing a lot better. People hurting their backs, picking up lumber and shingles and everything else. But you are back in full service now.
We're back in full service, Harry, yeah. We're doing our outpatient procedures to try to relieve pain non-surgically. We're seeing people in the clinic. Our open MRIs back up and running. So yeah, we're pretty much back to full service. We did have a few weeks where like I said, we couldn't do what we normally do, but yes, we are back up and running. Yeah, and we're off of generator power too, so right. That's great too.
You were talking something about the heat, like a lot of you can't do certain things physically because of the weather, right?
Well, when we were on generator power, we couldn't do our procedures. That's just a state regulation. We can't do our procedures safely because the generator's our backup. We were able to see people in our clinic, and schedule them a little further out. And as far as our patient census and our numbers, they might be a little bit down because people are preoccupied with getting their houses repaired. A lot of them stayed out of town for many weeks. They might just be coming back, so they have other priorities. But like you said, they might be injuring themselves too, so our business might be picking up.
Right. Look, that is part of it, and I wonder and I worry sometimes that our entire census of our area may not be the same, right? Mm-hmm. We keep going through hurricanes like this, and particularly a hurricane like this. What about your not your patients, but so much as your employees? These are all folks that obviously you want to try and work with your patients. but you have employees that are also dealing with the same thing, that live maybe some down the bayou and that kind of stuff. So they got to try and juggle fixing up their life and trying to help a patient that needs help getting back on theirs.
Yeah, and what we're doing with our employees is we're being very understanding with them. You know, if they wanted to come to work as soon as they could after the hurricane because they needed the finances, we let them come to work. If they needed to stay out to fix their home, you know, we worked with them. So, you know, now we're back up and running. And you think everybody pretty much has a livable place, so that's good. Still got a lot of damage to repair, but pretty much everybody that we had before the hurricane is back to work now. We're pretty much at normal pace.
I got you. Does your employees travel with you to New Iberia, or is that two sets of employees?
We have a totally separate staff. So our New Iberia office, we never missed a beat there, you know.
Right.
I think we did close for about 2 days right after the hurricane, but that was about it. They didn't really suffer any damage, and we were able to get up and running quickly over there.
Right. And you guys have an outreach where you kind of help people, like you were saying, if they needed help, you guys tried to rally and get that done. Huh?
We tried to, we bought schedules home. You know, we tried to call people, although telephone service was spotty there for a while. We try to use internet and the website and, you know, things like Facebook to keep in contact with people and try to get their pain relieved as best we could under the circumstances.
Like I say, our whole life seemed like we've been on pause a little bit, but pain, headaches, those kind of things don't stop. So you have patients, you guys up full service now and on cutting edge of a lot of things, as you always have been.
Me and Dr. Quadra try to stay up. We go to a lot of meetings. We do a lot of educational things. So if there's new procedures and new techniques to try and relieve pain, especially in a non-open surgical way, you know, we're usually getting trained on these techniques, and we adapt them into our practice.
You know, in New Orleans, you know, in 05, everything was like, you know, prior to Katrina, after Katrina. And I guess we're now going to be prior to Ida and after Ida. Is there anything specifically that you're seeing since the storm that, you know, the stress maybe may cause headaches, or physical stuff, maybe just people hurting themselves?
Yeah, we've kind of seen a little bit more a situation called compression fractures, where people are out in their yards and kind of working, and maybe they have osteoporosis and they might fracture a segment of their vertebrae. We're seeing that with a little bit increased frequency, and you know, people just getting out there and being more active. They might have some pre-existing type of arthritis, so they might be overusing it and injuring their back, or something may become symptomatic that had been there. So arthritis may have been there for years, but it's becoming more symptomatic because people are getting out and about and working in their yards or on their roofs or wherever.
Hey, look, yeah, my gym's been closed for 5 weeks, right? but I feel like I've been working out because every day I'm picking up something. I'm going to do something else. I'm cutting a tree and trying to carry a log. So it's a different thing. So for people that aren't used to that, or people maybe that are a little older that are trying to do things they shouldn't be doing, obviously getting on a roof, getting those kind of things, that could be real trouble, right?
Yes, and we are seeing that with increased frequency. And, you know, stress, everybody's got stress right now, whether it's fixing their home or trying to get their home repaired or their business repaired and up and running. You know, and I live in Thibodeau, and we only had a few things open for a long time. Right. Basically just grocery stores. So, you know, those kinds of stressors, and you mentioned before, getting gas was a stressor for a little while too. There, but any of those stressors can exacerbate or make pain worse. So yes, we are seeing that also. Right.
So let's start. The first word in there is headache. I used to study in the industry a little bit, but headaches were nearly 20% of the people actually have migraines in that area, which I was shocked when I ever read that the first time. So what are the new things that you're doing now and helping with folks with migraines and that kind of stuff?
As anesthesiologists, we're interventional specialists, so we do use medications and, you know, send people to physical therapy whatnot to try to relieve pain. But the basis of our specialty is doing precision-guided, either X-ray or ultrasound-guided injections to try to heal nerves. So a lot of times with headaches or whatever pain situation people might have, whether it's neck pain, back pain, sciatica, pain radiating down the arm with numbness, whatever the symptoms are, we'll try to use these healing, numbing and healing type injections or nerve injections or nerve blocks to try and heal a situation. So we do use these types of things in headaches also. Probably within the last 15 to 20 years, something called radio frequency has become more prominent in headache treatment. That's where we use radio frequency energy. It's kind of like a laser type energy to try and stun or cauterize some nerves.
The trigeminal area?
Yeah, trigeminal area. And sometimes there's a lot of crossover between nerves in the neck and the nerves that go to the head, or the trigeminal nerve. It's called the cervical trigeminal pathway. So sometimes if we eliminate the nerves in the neck or the cervical region, we can modify the headaches.
So you can use that as proactively or prophylactically, really,
And
as opposed to trying to wait till you see an aura before you take a triptan or something.
And a lot of times when we do these radio frequency procedures, you can get prolonged relief, many months to many years type of relief. And, a lot of times with headaches, we're not necessarily trying to cure, although we do cure some types of headaches, especially if they're coming from the neck. But a lot of times we're trying to reduce the severity and reduce the frequency, because when you have frequent, severe headaches, it interferes with your personal life, your social life, and your work life. So, that's some of the things we're trying to improve, along with the pain.
Yeah, no. Look, if somebody has if somebody truly has a migraine, they have to go lay down. They have to be dark. They have to be cool, and they're not raising their children. They're not enjoying a party. They're not participating in cleaning up after Hurricane Ida.
Yeah, exactly. Absolutely. So pain interferes with your life and causes we call it reduced function. You're unable to function in your daily life, whatever that entails.
Right. So, and a lot of it is age related, or some of it could be injury related. So 30 seconds here. So we'll talk about this a little later, but there's some new techniques that you guys are using, a cement and that kind of stuff that you go, cement, that's construction, right?
Yes. It's a relatively new procedure within the last 10, 20 years, but we do, with these compression fractures in the spine, we're able to relieve that pain immediately by injecting a small amount of bone cement.
Doc, we were talking a little bit about, you guys are up and running now, full functioning, and some of the new advancements that you're working with over there. One of them would be the disc, and I guess more of a degenerative disc. I hope I'm saying that right. And you can almost now cement some discs together that can kind of give somebody some help.
If you suffer something called a compression fracture of your spine, or a vertebral compression fracture, this can follow trauma, or frequently elderly people that have osteoporosis, especially if you up and around working in your yard now and you're not used to that. A lot of times it doesn't take a lot of activity to fracture something in your spine. And when you fracture a vertebral segment of your spine, it's just like a fracture of your arm. A lot of that pain is from the movement of the fracture back and forth. So you can imagine your back being a very mobile area. Just small movements will cause pain. So there's a procedure called a kyphoplasty, where we insert a balloon into the fracture, we expand it, try to get the height of the vertebrae back to normal, and then we inject a small amount of bone cement into the fracture. It's liquid. When we inject it, it hardens, and when it hardens, it stabilizes the fracture and eliminates that pain from the movement of the bone.
Are you touching the nerves at all, or is it encasing the nerves?
We don't have to touch nerves. We do it. We do put people under anesthesia when we do it, but we numb it up, and when we insert the instruments, they're more or less larger needles, but when we insert the instruments, we do encounter some nerves on the bone, but we don't have to go through any large nerves when we do it.
Okay, very interesting. Now, another way to do it, instead of encasing it like that and using cement is spacing them out, right? And you guys have actually used some cervical spacing as well.
Yeah, there's a different condition, spinal stenosis, which can happen to younger people, but more, middle-aged to older people, where the spinal canal might start to get narrow from aging. Like you might start to get arthritis of your disc and your facet joints, and that with some hypertrophy or some thickening of ligaments, it reduces the space in the spinal canal. And there's a relatively new procedure called Vertiflex or Superion, where we can go in as an outpatient, and it takes about 30 minutes to insert a little spacer to try and open up the spine and increase the space where the spine is getting stenosis or narrowed.
I got you. And all of these are a lot less invasive than what you might have to do. The ultimate, I guess, would be doing a surgery and that kind of stuff.
Yes, as an interventional pain specialist and anesthesiologist, we don't necessarily do open surgery procedures like laminectomies and spinal fusions and things like that. So we're going to do everything that we can to get people better. Yeah, before you have to have some type of major surgical procedure. We're going to do minimally invasive things to try to heal things or get people better without having major back operations. Yeah.
Now, joints too is where a lot of joint pain comes. Now, where does joint fusion come in between cementing and spacing?
There's a relatively new procedure of the SI or the sacroiliac joint where we can go in and do a minimally invasive type procedure where we can put a device to lock the joint. It's called a SI joint fusion procedure. It used to be a major procedure that involved very large screws, but if we don't get people better by injecting numbing and healing medications, we can go in and sometimes do these little small minimally invasive type procedures to try to fuse the joint to where the movement is not causing pain. The movement of the joint is not eliciting pain.
Right. So again, just kind of wrap up. So up and running in Gray and in New Iberia, and you're taking patients, and
we're taking patients as long as our phones are working. Usually they're working. Sometimes they go in and out, but electricity's on, and we're open.
Yeah, unfortunately, we're still in hurricane season, right?
We're still in post Ida season. Yes, we are.
Well, Dr. Jimmy Ponder, thank you so much for being with us today.
Thank you, Harry.
All right, that'll do it for this edition of Bayou Time. I'm Harry McCulla. Thanks for watching, everybody. We'll see you next time.